Florence Nakiunga is a resident of Katanga, Chimwanyi Zone, a Kampala suburb. She's a mother of a 9-month-old baby, and at the moment, she's worried about her son who missed out on his 6 months polio vaccine jab.
I'm worried that my son missed out his dose because we are told when we immunize them, it helps them boost their immunity. It's on this note I call upon our leaders to always focus on health matters in whatever situation to give the future generation a chance to live healthy.
The Ministry of Health yesterday announced an outbreak of polio and declared it a public health emergency in the country following the confirmation of lab samples in the capital Kampala.
Why these polio viruses can be detected through from human samples and environment. So this sample was picked from our environmental sites stationed at these 2 sewage plants.
The resurrection of polio in Uganda is attributed to the reduced routine immunization and polio immunization rates in the country during the COVID-19 pandemic.
And if you looked at our data over the last 5 years from our routine immunization, we see that over 2.1 million children are not protected against this type 2 polio virus.
Polio is a viral disease that is transmitted from a person to person, mainly through a fecal-oral route, as the doctor explains.
Polio is a viral infection that is transmitted through the mouth and the feces, through the 5 F's that we studied in P4, the fingers, the flies, the food, and feces. So it is hand to mouth.
Dr. Ampeire encourages all mothers with children that have missed out on jabs not to give up, and that they should take them to a hospital because it's never too late.
Any child under 5 years, you can catch up. You can go to the health worker for screening and they will give you the age-appropriate doses. But for polio, the more doses, the better. I mean, that's why we keep coming back with booster doses for all the polio vaccine. There is no really upper limit.
In response to the outbreak, the ministry declared a nationwide polio immunization campaign in October and December.
Polio vaccine among all the children under 5 years, irrespective of the previous vaccination status. This will be conducted through a house-to-house or door-to-door vaccination in October and December. And this is one of the interventions that is meant to close the gap and declare and close the outbreak.
Uganda was certified polio-free in October 2016 by World Health Organization after 10 years of not reporting any indigenous polio case. Shamim Natebwa for CTV PM edition.